So this week we read about pharmacokinetics, pharmacodynamics, and pharmacogenetics. Just kind of in short, pharmacogenetics is the study of how genetic differences in drug pathways affect an individual, which I thought was really interesting and hadn't thought a lot about, but I'll come back to that in a few minutes. Um, Pharmacokinetics is often described as what the body does to a drug, and pharmacodynamics is more of what a drug does to the body. For an example, I'm going to kind of talk about the pharmacodynamics of a drug that we use a lot on my floor. Um, I work on a postpartum mother-baby floor, so we work with mothers after they give birth and with their newborns. And a drug that we often give is Cytotec, and this drug is given for postpartum hemorrhages that mothers have. Um, it's also used for abortions, cervical priming, management of miscarriage, and induction of labor. But when we use it, it's for hemorrhages. This drug is extensively and rapidly absorbed, and it's detectable in the plasma. It's a synthetic prostaglandin that binds to myometrial cells and causes contractions and expulsion of tissue, which when we give it, that's what we want to happen. We want tissue to be extracted, and we want the uterus to firm up and cause contractions so that the hemorrhage will stop or slow down. Um, and so I knew when I give it, I know that it, of course, causes contractions, but I didn't realize that it was a synthetic prostaglandin, and that it was in the plasma. And I just didn't know exactly how it worked till I started reading about it, which I found really interesting. It can be given orally, vaginally, or rectally. Um, Orally, it's most rapidly absorbed by the GI tract, and the peak is about 30 minutes and declines in about 120 minutes. Um, when I started reading, I realized that orally it's given a lot of times to also prevent GI ulcers and people who have them um, consistently. And I had no idea that that was another way to use this drug. And for that, it's given orally. Um, Vaginally is more effective than orally, of course, unless it's given for the ulcers. The plasma concentration increases gradually and reaches its peak about 70 to 80 minutes before it starts to slowly decline. And after about 6 hours, the drug is actually still detected in the body. A downside to giving it vaginally is that it kind of works different based on each woman's vaginal mucosa. So it can work really well or not really work at all based on someone's body, which I guess is kind of related to pharmacogenetics, which I found really interesting and did not know. Um, Rectally is the route of choice for hemorrhage, so that's the way we give it. The onset time is very quick, it's very effective, and it's absorbed the most rapidly. So that's why we give it for hemorrhage, because hemorrhages need to be under control as quick as possible. Um, Effects on the uterus, of course, it causes increased uterine tone and contractions, and expulsion of tissue, and rectally that works the quickest. Um, so I kind of found it interesting, all of those facts about Cytotech, um, the different routes, how it affects the body differently based on the route that it's given, which I knew that we always gave it rectally, and I assumed it was because that was the quickest way, but I didn't realize why, and now I know why, which um, I really liked figuring out. Um, as far as pharmacogenetics, there was a statement in the discussion about if we ever thought about it. I really honestly didn't, but now that I looked it up and researched it and then read about it in our readings, there are times when I think it applied to my patients and I just didn't realize this. In the readings, it mentioned patients who are HIV positive and how um, their genes can affect or respond to drugs differently, and that was an example it used for pharmacogenetics. And I actually have had patients, probably not very many, maybe 4, that have been HIV positive, and I've noticed that some of them respond to the antiviral drugs and to different drugs that we give, and some do not respond at all, as well as their babies, unfortunately. So I found that interesting when reading about pharmacogenetics, that that probably was an effect, and I just didn't know that at the time. Other than with Cytotec, other than the vaginal mucosa, um, I didn't really find anything else in relation to pharmacogenetics when I looked it up, but I'm sure I know that this is like a newer concept that we're still researching and figuring out more about. So I'm interested to see how research and science comes along in the future with studying the human genome and how different drugs will affect people in different ways. Um, so that is kind of my example for this specific discussion board. There were tons of drugs that came to mind when I was researching and reading about this that we give, and I do agree, like the discussion said, that there are times when we are giving multiple medications to patients and how we don't really think about how the drugs interact with each other and interact with the body and how the body responds to the drug. So this was um, a great discussion topic for me to go back and think about the drugs that I give to my patients and how they affect one another and how they affect the body and how the body responds to those drugs. So from now on, I think I'll be definitely more interested when giving drugs to my patients and how they actually will work and how they affect people. Thank you.